All right, we are going to dive into a really, really important topic today, OBGYN emergencies and how to spot those major red flags. Knowing these signs can literally be the difference between life and death. So let's get straight to it. So you've got sudden pain, maybe some severe bleeding. You're asking yourself, is this serious or am I overreacting? These are tough questions, but knowing the answers is crucial. We're going to break down exactly what signs mean you need to get help and you need to get it now. You know, when you peel back all the layers of these different emergencies, it almost always boils down to fighting one of two huge threats. First, you've got hypovolemic shock. That's just a medical term for losing a dangerous amount of blood fast. And second, sepsis, which is a massive, out-of-control infection running wild through your body. Pretty much the entire emergency response is designed to stop these two things in their tracks. Okay, so for our first section, we're going to focus on crises that can happen during pregnancy, all the way from the moment of conception right up to delivery. First on the list is ectopic pregnancy. This is where a fertilized egg implants somewhere it's not supposed to, usually in one of the fallopian tubes. And this is a huge deal because that statistic you see there is staggering. It's the #1 cause of maternal death in the first 3 months of pregnancy. So what should you look for? Well, the early signs are what you might guess. Some bleeding, some pain in your lower abdomen. But the real alarm bell is if that tube ruptures. The pain becomes sudden, sharp, and just awful. But here's the sneakiest sign, the one that's easy to miss. Shoulder tip pain. It sounds weird, right? But what's happening is internal bleeding is irritating a nerve, and your brain gets the signal mixed up, thinking the pain is coming from your shoulder. It's a classic sign that something is very wrong inside. Now, let's fast forward to later in the pregnancy. Bleeding is still a major red flag, but it usually points to one of two things, placental eruption or placenta previa. And the biggest clue to tell them apart comes down to one simple question. Does it hurt? If the placenta is tearing away from the uterine wall, that's eruption, it causes painful bleeding. If the placenta is just covering the exit, that's previa, it usually causes painless bleeding. That distinction is absolutely critical for doctors. And this right here shows you how high the stakes are. With placenta previa, if a doctor were to do a routine internal exam, they could accidentally cause a massive, catastrophic bleed. That's why the rule is crystal clear. Imaging comes first, always. You have to see where that placenta is before you do anything else. Okay, so after delivery, the game changes. The new #1 risk is postpartum hemorrhage. To figure out the cause super quickly, medical teams use this handy memory aid called the 4 T's. It helps them check off the most likely culprits. Is it tone? Is the uterus not contracting down? Is there trauma from the delivery? Is there tissue left behind? Or is it a thrombin problem, an issue with blood clotting? It's a simple framework for a complex problem. And they need to be that fast because this is not some rare complication. We're talking about a leading cause of maternal death across the entire globe. That's why there's so much focus on being prepared to act in a split second. Now, it's not all about bleeding. High blood pressure can trigger its own emergencies. You've got eclampsia, which is when preeclampsia gets so severe it starts causing seizures. And then there's HELP syndrome, a really nasty variant that goes after your blood cells and liver. The name itself is actually an acronym for what it does to your body. It causes hemolysis, breaking down blood cells, elevated liver enzymes, and low platelets. And for both of these terrifying conditions, there's no messing around. The path forward is clear and non-negotiable. The pregnancy itself is driving the problem, so the only definitive solution is to deliver the baby right away, no matter how far along the pregnancy is. The last pregnancy crisis we'll touch on is blood clots. And as you can see from this chart, the risk just skyrockets during pregnancy. Your body does this on purpose. It enters what's called a hypercoagulable state, meaning your blood gets stickier and clots more easily. It's a brilliant protective mechanism to stop you from bleeding too much during delivery. But that protection has a downside, a much, much higher risk of dangerous clots. Okay, let's shift gears. We're now moving beyond pregnancy to talk about urgent issues that can happen to anyone at any time. And first on this list is adnexal torsion. I want you to pay attention to those last two words, surgical emergency. This isn't a wait and see kind of problem. Time is everything. So what is actually happening? Well, the ovary basically twists on itself, like wringing out a towel. This kinks its own blood supply, cutting it off completely. The result is sudden, excruciating pain. It becomes a race against the clock for a surgeon to get in there, untwist it, and save the organ before the tissue dies from lack of oxygen. Next up, toxic shock syndrome.
You can see the progression here. It's a rapid chain reaction. A tampon left in too long becomes a breeding ground for bacteria. Those bacteria pump out toxins, and suddenly you have a full-blown systemic crisis. But here's the key. The first and most important step of treatment is the simplest one. Remove the source. Get the tampon out. Pelvic inflammatory disease, or PID, is another serious infection that can spiral into sepsis. One of the telltale signs doctors look for is something they call cervical motion tenderness. It's a very specific, intense pain during a pelvic exam. When they find that, it's a huge clue that the infection is severe and probably requires a hospital stay with IV antibiotics. Okay, let's quickly compare two other things that cause horrible localized pain. You have a Bartholin's abscess, which is an infected gland that can get so painful you literally can't sit down. Then you have a strangulated hernia, where part of your intestine gets trapped and loses its blood supply. Two totally different problems in different spots, but both cause agony and both need immediate medical care. So we've gone through a lot of scary scenarios, but now for our final section, let's talk about the plan. This isn't chaos. There is a very clear, very effective emergency playbook that medical teams use to take control of the situation. When a patient comes in with these symptoms, the team kicks into a well-rehearsed routine. First step, always, are they pregnant? A simple urine test changes everything. Second, they need to see what's going on inside, and that means getting an ultrasound, fast. But here's the thing. While all that is happening, they are simultaneously working on step 3, resuscitation. They're managing the ABCs, airway, breathing, and circulation to keep the patient stable. And this brings us right back to where we started. Every single one of those actions, every decision, is all aimed at fighting off those two big killers we talked about at the beginning, massive blood loss and overwhelming infection. And when we say resuscitate, what does it actually mean? Well, it's this three-pronged attack you see here. It means cranking up the oxygen, flooding the body with IV fluids to keep the blood pressure up, and giving blood products if they're needed. It is an all-out, aggressive effort to stabilize the patient and pull them back from the edge. Okay, let's boil this all down. What do you really need to remember? Number 1, if you are pregnant and have painful bleeding, it is always an emergency. No exceptions. Number 2, sudden, severe pelvic pain needs immediate attention, pregnant or not. And 3, know the signs of sepsis, high fever, confusion, low blood pressure. The medical teams have the playbook, but it only works if you get there. Your job is simply to get help fast. Look, the point of all this isn't to make you scared, it's to make you prepared. It's about empowerment. Knowing the signs is the first, most powerful step you can take. So I'll just leave you with this to think about. What's the one red flag from today that's really going to stick with you? Thanks so much for tuning in.